So as always, this presentation is a team's effort. So I'm here to speak about the National Priorities Program for Adult Social Care and Social Work, but this is a very wide program, including about 8 other ARCs. So I'm speaking on behalf of all the collaborators, the research fellows, and of course, this is a joint presentation with Professor Julian Forder, who is leading this program of work, as well as the regional social care team within the ARC in Surrey and Sussex. What I'm going to do in the presentation, hopefully I'm not going to take the whole half an hour. I want to give you a brief overview of the program, how our project actually emerged, and also what are our plans for the future. So we all know that the ARCs have been funded to do really applied research. So we want to make research, to conduct research that makes a difference and has a real impact. And we don't want to conduct any research. We want to conduct research that actually is based on the priorities of both care users, of both carers, practitioners, professionals, researchers, and the wider public. So the NIHR have funded the 15 ARCs, of course, like we all know that, but all these ARCs are working on some priority areas. And ARC and Surrey and Sussex have been really successful in actually leading the priority in adult social care and social work. So this is how the National Priority Program for Adult Social Care has emerged. It has received 1.85 million funding from the NIHR. So this program is meant to last for 3 years, ending in end of September 2023. As I said at the beginning, this is a wide collaboration. There are another 8 ARCs involved. And as you can see in the map, it's quite a nice geographical spread, including most areas of England. So as I said initially, we really hope that the priorities that we identified are really relevant for users and practitioners and policymakers across the whole of England. We all know that there are probably so many priorities in adult social care and social work as in health, actually. You know, we can choose so many things to look at. And today we have some really lovely examples of things that actually matter to people. So we really had to think quite carefully how we identify the priorities for this work. So the first phase of a project, actually of the program, actually looked at finding ways to actually identify these priorities. And this phase has actually completed, which is good. So I can give you an update about where we are with that one, as opposed to the research week that was in December last year, where we only presented an overview of the whole project. So hopefully now there are some updates that we can share with you. Then now we are in the second phase of the project. We are actually full on developing the implementation work. So we are actually supporting the implementation of various social care interventions. And hopefully, as we approach the end of the program, we're going to use the outcomes from this work that we are carrying now to improve the evidence base for adult social care and social work. And of course, more importantly, improve the capability and capacity for applied research moving forward. The first phase of the research has finished. I'm not going to spend an awful long time on this. There is a report, an in-depth report on the website, and I can post a link in the chat at the end of this talk if you want to find out more. But very briefly, we undertook a prioritization study. This was conducted in 2 phases. The first phase was to develop a long list of potential priorities for adult social care and social work. We looked at a bit of a documentary review, looked at what's out there in terms of, what's influenced by the CARE Act 2014 and what are the other topics that we could look at. We also had a thorough discussion with our partners, and they scoped the priorities within the regional areas, and also with the help of our local implementation managers as well. We canvassed the view of the sector and also what are the views that matters for our KSS as well. After this exercise, we came up with a list of topics that I think there were 10, if I remember correctly, a long list of 10 topics that we had to shortlist further because of the resources. But as I said, we could have chosen all of them. I mean, all of them were really important and interesting. And if you want to know which were the other 7 that weren't selected, you can have a look at the report as well. So in order to come up with 4 priorities for our work, we went through a very in-depth prioritization process. We had three groups that we consulted to. The first one was the policymakers and professionals. The other one were people with lived experience of actually accessing the social care sector. And we had another consultation with our consortium itself. Obviously, we were interested to find out, so this is the activity in which all these contributors have engaged with. We were interested to find out, okay, so what are the topics that you think they are really beneficial for the social care system itself, but in the same time, how feasible it is to deliver those projects and how much of a priority they are for you within your local area. So they went through a scoring exercise based on this beneficial aspect and the feasibility as well. And we combined the results and we ended up with 4 topics that we are going to take forward. And as I said before, these 4 topics are actually now growing and developing and are running as planned. Very quickly, the first one has a particular focus on care homes, looking at well-being and implementation of outcome-based practice. So we all know that there are a lot of people, and especially older people in the UK, that reside in care homes, and their needs to be assessed. And in most cases, this assessment has to be taken considering their people actual needs, their well-being, and what outcomes they actually want to achieve. And we have examples of the excellent practice of using tools to actually measure those needs. We have the Adult Social Care Outcome Toolkit that has been developed at Kent, looking at social care related quality of life. We also have IceCap, which was developed at ArcWest, looking at measuring people capabilities in different domains. So we do have examples of excellent practice, but in the same time that care homes are collecting so much data about the well-being overall, we're using these tools as well, but how they're actually systematically used to inform care is quite problematic. What it's also quite problematic at the moment is obviously because of COVID and Brexit and things that happened with the care homes. Implementing any type of intervention without co-producing it with the staff beforehand is probably deemed to fail. So we really want to think about, how we can actually develop and inform the development of one approach that can be co-produced with the staff and the people with lived experience and can improve care planning in care homes. So what we are doing at the moment, we are conducting what is called a systematic scoping review that we have registered recently, looking at identifying and learning from existing care planning approaches. We really want to, as I said, involve in a co-production activity with the sector to understand what are their perspectives about care planning and outcome-based care planning in general, and what makes a successful care planning approach that can be, more importantly, sustained and sustainable within the current environment. And we want to co-design a quality of life care planning intervention with the care home sector, and hopefully be able to do a bit of feasibility testing if the time requires. The next project that we are currently, as I said, is running at the moment quite successfully, is looking at digital technologies called DITSO. So our focus is on digital technologies for community dwelling adults in receipt of social care. I don't have to go into too many details in explaining, what COVID meant for digital innovation. So it has been an absolute boost of digital innovation, especially after COVID. Everyone is trying to do remote. There are lots of, especially within the healthcare sector, the telecare, trying to replace the need for face-to-face consultation. Everything is moving digital, remote. So it's been an absolute boost of digital innovations. But what we're actually very interested in at the moment is actually to explore what type of digital innovations and technologies are used to promote social well-being. So not necessarily focusing on health, although that can't be ignored. So obviously we need to approach this within a whole person perspective, but we are really interested in social well-being, and we are interested in things that innovations that are happening to reduce social isolation and improve social contact, and not necessarily in care homes, because this is where most of the innovations are taking part now. We are looking at people that are living at home, so within the domiciliary care as well. So at the moment, we are conducting a scoping review to explore and map digital innovations that contribute to social well-being. And I've added a small image just to show you what preliminary findings in terms of like digital tech, looking at remote health, monitoring at home, personal technologies, and also care home technologies that are trying to be used within the home care sector as well. We have conducted about 8 interviews exploring the perception of commissioners, providers, community organization, tech developers, about their perception of the value and adoption of digital tech for the improvement of social well-being. And we want to do in the last work package, we want to choose one piece of technology that we can assess in terms of what are the challenges and barriers and facilitators to putting that into practice, and what would be the best way of evaluating digital tech for social well-being. The next project is looking at intimate partner violence and abuse. This is a really interesting project called Vista. The acronym is Vista. So we all know that intimate partner violence and abuse is extremely important, and it's a substantial social issue, has implication not only for the survivor, but also for the children and the society overall. However, most of the local authorities, at least historically, they used to approach a more like failure to protect discourse, where in cases of the intimate partner violence and abuse, the focus and the whole attention was actually on the child, which of course is completely understandable. However, the survivor was neglected in terms of their needs and their safeguarding, if you like. So everything was mainly for the child and not for the victim, the survivor of the IPVA. And this has kind of like raised a lot of issues, especially if you want to look at the family approach, as I said as well, for the digital tech. If you want to look at, the whole person approach, it's quite important to actually understand that you can't detach those two. And within the social care sector, the communication between the adult and social care services sometimes can be problematic, especially since there are survivors involved from both sides, as well as the multidisciplinary working between people who are survivors of IPVA and children within those environments. So we really want to look at integrated models of delivering care for IPVE, which are looking at both adult, the children, and also other agencies that can be really important in tackling those issues. In the first phase of the work, we are currently conducting, this time is a systematic review. So for the other ones was more of a scoping one. So for this one, we are currently running a qualitative systematic review, which has been registered with Prospero. So if you want to have more details about it, so we are looking at innovative models and solutions regarding IPVA. The second phase of the work, we're going to explore the barriers and facilitators to this integrated working between adults and children's social care and related agencies as well. And we want to identify, similar to the previous one, we want to identify some whole system implementation models that we can evaluate, learn lessons for implementation, and more importantly, maybe develop some recommendations and guidance to actually improve practice for victims and survivors of IPVE, with the focus on a whole system approach rather than the children themselves. Last topic that we are actually working on, again, this might not come as a surprise because this is a topic which has been researched quite broadly within health and social care, actually, looking at strengths-based approaches. And there are different ways of calling it. So this is just one way. Asset-based practice, for instance, is another way of looking at it, looking at people's strengths. Primarily. So we are kind of moving towards new thinkings of how to organize social care, focusing on being more person-centered, looking at person's strengths and capabilities. So moving away from the medical model, more towards the psychosocial model of focusing on what people can do best and what outcomes they want to achieve, and what support is available from families and the community with the healthcare sector as such. There are loads of strength-based models in health and social care. Their evidence-based sometimes is questionable, but there are two particular models that draw our attention, and we wanted to do a bit of more work to explore them further. One is called community-led support, CLS, which is this. So they are actually, what's interesting about the community-led support is that they are militating for a whole system transformation. So they are working at the moment across 30 local authorities in England and in Scotland as well. And they really want to change the way the care is delivered within the community. They want to look at giving the support that people need before the crisis actually occurs. So this is something that they want to do here and there without, it's more of a preventative approach, without people having to go and access specialized services. They want to really explore what's available in the community based on concepts like leadership, culture, things that they can do to actually focus on what people's strengths are and how they can work with that before accessing services that can eventually become more costly as well. The other strength-based approach that we are currently looking at is called the connected communities. This is more closely to what we used to call historically we used to call social prescribing, but again we are moving away from that definition because that implicitly implies there is more of a medical model that requires some sort of treatment and fixing, if you like. What we want to, so how connected communities are better defined is a person-centered community support model that actually has indeed a link worker or a community connector that identifies what needs the person has and directs them within the wider community area to find what is needed to address those needs. So although it's similar to the social prescribing, again, it's more like, it's more based on the idea of the connection within the communities and someone being there as linking people with the needs and resources that they need to access. And again, before the crisis actually occurs, there is more of a preventative approach. Unfortunately, as the evidence base for some of these approaches is not very well developed. So for instance, for the community-led support, there's been quite a lot of evaluations, but mainly internal. So it's not many peer-reviewed work that we can look at. For the connected communities, there are some academic papers that have been published, but then again, most of the evaluations are quite internal, and we don't really know what make either of those approaches quite successful, especially within social care, because for instance, the connected communities are still based within the general practices. So we want to really understand what are the lessons for social care. We want to, in the first phase of the work, we want to identify the key features of these strength-based approaches. We want to assess how best we can put them into practice. And this is about implementation and what makes them successful. And we want to work with the local partners to develop insights about how can we effectively use them in practice. So it's all about co-producing the best approaches to make them a success. Where we are with these two pieces of work. So for the community-led support, we already have 5 sites in England that have volunteered to be case studies. We are now doing a documentary analysis to provide an overview of the program. But as I said, most of the documentation is coming from internal reports. We are already agreed to conduct about 5 interviews in each case study, so using the theory of change approach and eco-maps to explore issues like culture, leadership, co-production, and the use of data. And of course, we are also interested in effectiveness and trying to prove that they actually make a difference. And there is some potential to collect system and client level data that we are currently exploring with the sites. So we want to co-produce this approach with the sites themselves and together with them to find the best ways of actually evaluating how well they might work. For the connected communities, or the person-centered community-based support service, which is a very long name, we are in the process of conducting a mixed meta study. So this is going back to more like, like purely implementation and implementation science type of work. So we are using the normalization process theory to understand the process of embedding this new support service into usual working practices, especially after COVID. and also using the consolidated framework for implementation research to identify the contextual factors that are affecting the service implementation. In the first phase of the work, we are doing a documentary review. So we have also, as I said, we have some academic papers about these modules. We also have internal evaluation posters submitted at conferences. So we will, and we are going to use the CFAR and MPT to develop a framework to extract the data from the published materials. We are also conducting interviews with approximately 20 participants per service. And we want to ideally present the findings to the social care stakeholders in the form of some focus groups to inform some recommendation for practice. So this is the last part of the work. So this was just a really, really quick flavor. I know I probably didn't do them justice, just because I didn't want to run over the time, but I'm quite happy to take more questions about the projects themselves, which are all really, really interesting. But as I said, we do have some aspirations for how this work can develop going forward. And we want to contribute to develop the infrastructure for research, for applied research in adult social care and social work. And in order to do that, we have a whole piece of work looking at public and PCIP, public and community involvement. We have a national strategic group that went through a prioritization as well, and to a really thorough selection. We have 15 members that are part of the strategic group, or people with lived experience of social care from different ways of life, who are going to help us deliver all the 5 projects I have mentioned. We also have some project-specific co-production groups of people with lived experience to make sure that we always keep in mind what's important to them. We are also quite actively developing resources to support evaluation and research, which is developed by us or by our partners. I've just added 2 images of the outputs that we have produced. One is looking at equal access to the knowledge table, and also at some priorities that have been established based on James Lind Alliance. And of course, we are working with other programs on applied research in social care, the Impact Center, just to understand and make sure that whatever we do aligns with what are the needs and what are the priorities at the national level and supranational level as well. As I said, this is a huge program of work, and for more information, you can access the website as well. You can always follow us on Twitter. And I look forward to any questions that you might have. Thank you.